Welcome, everyone. What we are going to cover today is nutritional interventions in chronic disease. We find that more and more patients are asking their doctors and their health professionals how to do things related to they don't want to take this medication or what have you. The doctors, obviously, you're aware that you're informing your patients that they need to make nutritional interventions. And we basically, as Health Southeast, work in partnership with physicians and licensed medical professionals and health professionals all over the Southeast U.S. and have for almost 20 years. We are a team of people in partnership with Nutrimetrics Custom Health Solutions as well. So we have some systems that we use to be able to implement very effectively into the office and all at no cost to the practice. And I'll explain that as we go along here. So just to briefly go over, there's a huge changing paradigm that's been going on now for a number of years, but it's kind of coming to a culmination now. Health professionals are reporting several factors that affect the new economic climate that we're in. We all know there's rising business and drug costs, but studies are now actually showing and coming out the relationship of nutrition, oral health, exercise, and other matters that affect overall well-being of our patients. And we also are faced with the changing regulations coming to ICD-10 for reform in 2015. And it's going to affect a lot of not just the health practitioner, but it's going to affect the patient. It's going to affect the insurance companies. And so we work with all of these factors coming together. Also, we are now seeing mainstream media is reporting things. We're finally seeing things that they're finally picking up on it because they have to. Wall Street Journal, and a lot of this started back in 2011 where we started seeing things hit the mainstream media. Today it's all over and you can almost pick up something almost every day or every week and see an article. So that was from March 16th, and then in January CNN Money showed that doctors were living on loans. You're very aware of this as a practice, and so we come in as medical business consultants to be able to partnership with you, not physically on paper as a business partner, but I'll show you how we align with you to help you increase your revenues by offering more nutritional interventions. With increased exposure to a variety of media formats, our patients are becoming very aware. They are not, I say very aware. I always say you can find what you want on the internet. You can find a positive, you can find a negative on almost every topic. It just depends on what you're looking for. And surveys have shown when we survey patients, and we've done this for years, they always want their health professionals to be the ones to give them specific wellness suggestions, recommendations, and guidance. So we know that that's really important, but we also know, as you know, it's not something that you've been brought up in your world on. Most of the doctors we talk to, it's very hard for you to keep up just with all the changes in economic reform and all of those things and keep up with the changes in the drugs that are available and also all the different diagnosis codes, etc. It's hard to keep up with everything to then be able to also be good at nutrition when it wasn't something that you were taught in school. So our mission as Health Southeast is really to support health professionals through mutually beneficial relationships. Like I said, it's not a true partnership. It's more of a mutually beneficial relationship. And we come in to help educate your patients in science-based nutrition and lifestyle choices to create healthier communities and bring communities of people together for referral purposes. We offer a complete suite of customized cutting-edge solutions exclusively for licensed health professionals. And we offer a wide variety of products and services designed to better serve patients and generate ancillary income for your practice. Relevant education, because it's an ever-changing industry and we have to keep up to date. There's new science, new research coming out every day. And so that's what we keep up to date on and bring to the practice. We have over 30 years of experience in wellness education. And if we couple all of us together as team members, it would be well over 100 years. We are in the right place at the right time, meaning there are a lot of avenues for you to take right now where you can make a lot of money and a lot of extra money for your practice. When you're in partnership with Health Southeast, you're also in partnership with NEI because we have a partnership with NEI. NEI is Nutrimetrics Educational Institute, where we are helping health professionals generate additional revenue for their practices while providing wellness-based products and services that your patients are asking for. It is not just product-driven, it is also service-driven. There's a lot of things here, but nothing that you have to buy up front. We already know that patients are already purchasing wellness products and services to the tune of $22.1 billion annually. These are things that have to do with healthy choices when it comes to foods. Organic movement has made a huge impact. Exercise programs, supplements, treatments, just a variety of different things are considered part of this wellness paradigm shift. More than 53% of adults use dietary supplements, according to the CDC report back in 2011, and that has only increased. So what are your patients buying, and who's giving them the advice? This is where it comes in that patients are looking for their health professional to give them the advice. They don't want to go into the health food store and try to figure it out, and they surely don't want a health food store attendee that's getting paid a little above minimum wage possibly to give them their advice. They want someone who knows their body, knows their medical conditions, to be able to give them that advice. So what we do in partnership is we provide the education to you and your staff and through your office to your patients, depending on how you're set up will depend on how we offer that. We will completely customize it to be able to be streamlined into your practice. So, is the average consumer educated in science-based nutritional support? Not really. Many of the most popular brands have very attractive labels full of ingredients. They'll come out and tell you things like they're whole food supplements when not necessarily are they completely whole food supplements. Marketing is a huge game, and so I personally ended up doing this because of the fact that I had health challenges back in my 20s and in my 30s and overcame a lot of that and decided that I needed to start looking and becoming educated. So I went on this major research project to be able to get myself well. And in doing that, I learned that what we're allowed to market on the front label of a product versus what's actually in the product and what we can say to people are really very, very, very different, almost bipolar. So we have to look, because your products that you're getting off the shelf or even in a prescription are filled with all of these different things listed here. And I don't know about you, but I surely don't want hydrogenated oil or talcs in any of my products that I'm consuming, let alone we surely don't want artificial and chemicals and things like that. We're organic bodies, and that's what our bodies need. But when we look at popular store supplement labels, and this could also come down to private labels that are not sold in stores, I see a lot of this. It's not just in these popular name brands that are sold in the stores. But look at this. You've got hydrogenated palm oil. You've got talc. You've got all kinds of food dyes and things like that with aluminum in them. These things have been proven to be cancer-producing and lead to many disease processes, and the studies are out there. And then, of course, we've got our favorite for our kids, Flintstones. Flintstones, I don't know about you, but if you're a parent, do you really want your child consuming hydrogenated soybean oil and aspartame and all of this aluminum? We really need to look at what are we putting in our bodies. But again, the patient doesn't know. They're watching the advertising, and so they don't know. And they go to the store and they pick up what they think is the best based on the advertising they saw. So that's where we come in. Health Southeast evaluates your practice needs at no charge to determine what services and systems may be a fit for your patient base and revenue needs. And then we submit a customized solution for your review. And then we work in synergy with you and your staff to bring the quality programs and systems provided through our partnership with NEI and Nutrimetrics Custom Health Solutions. It's a very simple process. It costs you nothing. I want to just give you a little overview of what the Nutrimetrics difference is and why we chose Nutrimetrics to align ourselves with and partnership with. Because they offer an isotonics-capable solution in nutritional products, which to me is huge. And I will go over all of these very quickly. They offer customizable products, which is very important to us. They do gene SNP testing to be able to look at someone's genes and do a laser beam approach to their nutrition of what is very deficient, what variations do they have that affect what uptakes they have, and different coatings. TLS weight loss solutions. Obviously, we have an obesity epidemic in this country, so weight loss is a very important part of what we do, but I'm not looking for a diet. I want something that's going to be lifestyle oriented, that people are going to be able to take the weight off and keep it off for life and live the lifestyle. Patient education, consultant support at absolutely no cost to you, and staff education. So you really want to ask yourself, what today sets you apart as a practice? What's setting you apart from other practices of the same specialty in your area? What makes people choose you over someone else? It used to be this person took this insurance, this person took that insurance. Today it's still driven by that a little bit, but and HMOs really, affected how we made our choices as to who we went to see as our practicing physician. But really look and say, what sets you apart? Is there something? Because when you can set yourself apart from the other specialists in your immediate community and your area, I can tell you we can help you increase your revenue through making sure that your patients are happy and coming back and really giving them what they're asking for, which is quality health care. So Nutrimetrics provides a huge commitment to quality, which is something we looked for. Their products lead the industry thanks to cutting-edge ingredients, sound science, and exceptional quality control. I can promise you, if it's not in the science, it's not going in the product. We have visited different laboratories with Nutrimetrics. We have gone to many different science symposiums, and Nutrimetrics always seems to come out on the top. The product brokerage advantage of Nutrimetrics is it identifies the latest market-driven products from the best manufacturers. They do not use just one manufacturer. That way they can source the best ingredients, the best manufacturer for that particular product line. It provides comprehensive and synergistic formulations based on current research, and it offers a wide variety of products formulated by experts that are in the industry. This is not just market-driven garbage, or as I say, junk science. It's very important that we get products that support what we're talking about, like, for example, calciums and omega products, that we get what our patients need so that they're going to get the results they're looking for and the solutions. Our success reflects your success. The more we are able to get out and create success in the marketplace with more and more practices, we continue to go up and up and up. You can see that we've had just continuous increases since we started 10 years ago. So the commitment to quality, just to very quickly go over, every product is manufactured with strict quality control guidelines and continuous quality control monitoring. We do meet all GMP compliance. Everything is sourced with certificates of analysis in our raw materials, and everything is inspected at the warehouse. I can go into more detail on that when we meet with you individually if you're interested. I want to briefly explain isotonics. Isotonics simply means that it becomes the same pH level as the body fluids. So when you take in an isotonic orally, it is a superior nutrient delivery because it actually has been shown to give about 90 to 95% absorption. There's exceptional quality control measures, and all of the ingredients are sourced for quality ingredients. We have comprehensive and synergistic formulations that work together in the body. So you can see there's a lot of different bottles here. Basically, this is something that they could take individual bottles. I'm going to show you how we can customize that as well. And again, this is just one component because products are not everything. When we look at customizable products, it's the ability to design customized isotonic-capable formulas that give you and the patient both value. And that's important. You need to make sure the patient's getting the results they're looking for and getting the value so that they're going to come back again and again to you. Your value is that you can customize each formula and put it into a custom cocktail so you can decide what dosages you want of everything, and we will help you decide that for your practice based on the diagnoses that you're basically seeing. We could, for example, Dr. Smith create a diabetic formula. And so we could create a nutritional support intervention that's going to help a diabetic. And that would have your name on it, on the bottle, and it becomes your formula. They can't go out and know exactly how to duplicate that by going out to the health food store. So they have to come back to you, and we'll show that it's not necessarily a physical you because I know you're busy. We're going to show you how we overcome that obstacle. And then the patient value is it's one-stop convenience. It's simplified. It's customized. It's customized directly to their need, and they have their doctor overseeing it, and there is auto ship for easy refills. The GeneSNP is very, very intriguing. What is unique about GeneSNP is that we test 43 genetic variations, and it, like I said, is a laser beam or customized approach to someone's individual needs. And they get a health action plan to support their fitness needs with it. It adds value to what you're giving them, and it will also add value to you as a health professional when you can see their gene SNPs to be able to really look at what the genetic variations are from a standpoint of the health practitioner. So you're going to be able to make lifestyle recommendations to that patient based on the results of their test. The patient, again, just loves the fact that it's an easy formula to be able to use, and they get the results. And when they get results, they come back, which is why our numbers continue to go up. TLS Lifestyle Solution, another program or system that we've coupled with, is very unique in that it is what I love about it, and I mentioned it before, is it's a lifestyle approach. It's educational approach. This little health guide right here is a very huge key as well as a website that we use to be able to give them science-based weight management systems. So they get their online support. There are supplements that maximize the results. It's about eating right and eating the right things and learning how to do that. There are foods available if they need them, but quite honestly, we're teaching them how to eat, how to go to a party and be able to manage everything, how to do it without eating out of a box for the rest of your life. So it is not food-driven in terms of eating out of a box. We do have shakes and bars and some meals and things that can be ordered, but quite honestly, it's not about that. It's about learning how to run your life and have a lifestyle that's going to last forever. And we can tell you it's very effective. We have a lot of people who have had tremendous results. As a matter of fact, we've had a lot of health professionals who have had results and have been able to they end up teaching classes because they're so passionate about it. You also receive an online value in that you would receive a website through us if you chose with Nutrimetrics.com. You can work directly with Health Southeast where we provide the products and systems to you, or you would be able to actually also get a website where you can have access to the website. So for $159.95, you have that access to that website for a year, and it would have your practice name on it, or it can be linked directly to the website you already have if one exists. And the value is that there's constant educational support there provided by Nutrimetrics Custom Health Solutions, so it's very educational based. All of the different products and supplements are there. It has access to also surveys, the Nutri-Physical that's down here. The Nutri-Physical is a health survey that will help them determine what things to take. There's nutritional blogs continuously, and it's easy for them to order or reorder or put themselves on auto ship if they so choose. What it is for your office is it's simplified implementation where it does not take a lot of time. It's very minimal amounts of time where your staff would be able to check to see if orders have gone through and be able to just make sure everything was processed properly. It is minutes. And so it's a leveraging technology, and it's a very easy tutorial to be able to do it. We have lots of marketing materials for the office, from posters to handouts and brochures to patient product guides to just exam displays, videos, etc. We also provide ongoing training opportunities because we are totally committed not only to your success, but we know success comes from continuing education. Health professionals have access to the NEI, which is the Nutrimetrics Educational Institute, which offers a Nutrimetrics implementation and product training. And we also have staff support, a lot of the health professionals will actually also attend the Nutrimetrics consultant training, which teaches staff members and you how to support your success from the inside out. So from inside the practice, how do we actually get this moving and support it to be able to become a revenue stream? We have an upcoming NEI training, which is 12.5 CMEs or CEUs, depending on your specialty. It is called Nutritional Interventions in Chronic Disease, Theory or Therapy. It is November 14th to the 16th in Las Vegas, Nevada, and it is open to all licensed health professionals. If you are not a licensed health professional on this call, you would not be able to attend this course you would have to go to the NC course, which would be the Nutrimetrics Consultant course, where we teach how to manage things from the inside out, so from inside the practice. So I thank you. Your next step really would be to contact us. Our contact information here is at the bottom. You can either call, text, or email, but get your questions answered. If you leave your questions to just sit, I could tell you nothing will ever change. So you can schedule a no-obligation consult with us to talk by phone or in person and have us customize a wellness plan to see if it's going to fit the needs of your practice. If it's not going to fit your needs of the practice, it's of no use for you to move forward or us to move forward, but we won't know that without a discussion. So we hope to hear from you, and we hope that you've learned something new today. And if you have any questions, by all means, contact us. We hope to hear from you. Take care.